Okay, well, welcome everybody. It's now 6:01. I want to go ahead and get started because we have a lot of important items to get to and only 1 hour to do it. Welcome. My name is Manuel Bonilla. I'm the president of the Fresno Teachers Association. Thumbs up if you could hear me, panelists. We hear awesome. Thank you very much. We have about 70 people joining us on the line right now. However, we are recording this as well, so that way we could post it for the rest of our membership because, and any other educators or community members as well. We know that there are a number of them that are actually hosting virtual back to school nights tonight, and so unfortunately they can't join us live. I want to introduce our panel and again, show my appreciation for, I know that these people have been very, very busy. So just thank you for their time. We have Dr. Karen Dahl. Dr. Dahl is the Vice President of Quality, Patient Safety, and Medical Affairs at Valley Children's Hospital. She's also board certified in pediatrics and pediatric infectious diseases by the American Board of Pediatrics. So thank you for joining us, Dr. Dahl.
Happy to be here, thank you.
Thank you very much. We also have David Lucchini. David Lucchini is the Assistant Director at the Fresno County Department of Public Health. We have Dr. John Zeifler, Medical Consultant at the Fresno County Department of Public Health. And
good evening.
We also have Dr. Chai Rongkavidviolet, as I pronounce it. I'm sorry if I pronounced it incorrectly. Dr. Chai is the clinical professor and specialist in pediatric infectious diseases at UCSF Fresno. So again, thank you so much for your time. We really appreciate it. We again have a jam-packed session in some respects for those who are joining us, mostly in the educator community that you know, we know that this virus has definitely taken its hold, not only throughout the world, throughout our nation, but definitely locally as well. And so we're going to talk today about the impact on our community, specifically about education and looking forward in Fresno County. So we'll have our panelists provide some insights and clarity about a variety of topics, including something that educators have probably heard about recently, this small cohort guidance, and what exactly does that mean? So we'll go ahead and talk a little bit more about that. And then everybody's topic, hot topic of reopening our schools and what are some of the health guidelines with that. And so we have a few questions, panelists. Just so you know, as I moderate this, a few questions have been submitted by our membership in regards to items that they would like to talk about. If we do have time at the end of this session, I'd like to be able to also allow for time for people to ask questions live. However, I will go ahead and get us started. Big picture to kind of specifics, let's just talk about where we are as a community. So where is Fresno County doing right now in comparison to the state, and are we moving in the right direction? So I guess I'll go ahead and start with David Lucchini from the Fresno County Department of Public Health.
So I'll start off with the numbers real quick. As you, we just updated them just today, the latest numbers. We have about 26,640 cases. So we continue to see an increase, but I could say it's definitely slowed down the rate of cases each day in Fresno County. Traditionally, especially when you look at the July and August, San Joaquin Valley was probably the highest cases and hospitalization rates that you saw compared to the rest of the state. Hence, we got the attention of the state task force that came down and was working closely with us. So these last 2 months have been very busy, especially after we hit that 4th of July weekend. Currently, we've had 326 deaths. And when you look at the last 14-day period, us and a couple other counties in the valley, we've been in the top 6 or 7 for the highest death rate in the last 14 days. But thankfully, overall, it is slowly going down. We are seeing improving numbers, especially over the last 3 or 4 weeks. The hospitalization rates have gone down. When looking at the dashboard, we're seeing a significant decrease in the number of confirmed cases in hospital beds and also ICU beds. When I look back, some of those numbers we hadn't seen probably back from early July. That's how high we had gone in these last 2 months, and especially in early August. The numbers were very high when you looked at hospitalizations and ICU beds that were taken up by patients that were positive COVID. So we're at least on a good trend. Some of our numbers, the one number that really looks pretty good is, at least on the trend wise, is we're under the our cases average per day per 100,000 over the last 7-day period has gone down to about 12.6. So that actually allows us to really review with the health officer, allows the health officer to consider any waivers for elementary to be open. So those would be discussions we'll be having if we maintain under that 14 cases daily per 100,000 over a 7-day period. If we stay under that, like I said, the health officer can consider waivers from schools to open elementary. That is only K through 6, not middle school or high school. To be able to go to the next stage, tell me if I'm going too far.
Yeah, we'll definitely get into the more specifics of that. Just really wanted to stay.
So I'll stay off that, but I can tell you, trending in the last 3 weeks, if we continue, we're on the right path.
Okay, and then
we got to continue to be vigilant.
My next question is, I'll have you do a quick follow-up to that. Is just almost tell us what we already know. What are some of the ways that we could help mitigate those numbers in order to?
Well, once again, we got to be careful. Every time we got to continue to avoid gatherings. We continue to see family gatherings, social gatherings occur, and that's where the spread occurs. We continue to see, it's gotten better though. I got to say, when I've gone out, when I've had to go to the stores and all that, I do see more and more people with masks. So that's good compared to a couple of months ago. But we need to continue to use those masks, because I know sometimes we get excited about numbers and then we want to go back. It's human nature. We want to go back to how we were before COVID and not wear masks, but we still got to be very vigilant on wearing the mask. We still got to be vigilant on doing the physical distancing. We've got to avoid those extended times, especially indoors. Those 3 things are critical, including the hand washing, of course. And once again, not being around people who are sick. And if you're ill, not going around people. And that can be very tough sometimes, especially I know the noses start running a little bit with the smoke in the air and everything like that. And it can be tough to figure out what's causing some of these symptoms, but we got to be more conservative. If you are feeling symptoms, you need to stay home.
Thank you for that update. And I want to go ahead and get a perspective as we pivot to just still in the community aspect of things. In our conversations with some of the health professionals over the last week, I was actually surprised as to how young kids can be and actually wear a mask. So one of my pediatric specialists, at what age do you recommend wearing a mask?
I can take that one and try, then you can chime in. I think the American Academy of Pediatrics has recommended age 2 and above as the age for wearing masks. And that's a little bit dependent on development of the child, of course. And I would say there are older children who have some disabilities or some sensory issues who may not be able to tolerate a mask either. So I don't think it's going to be 100% among the children.
So basically, based on the CDC and the AAP guideline, basically any kids older than 3 stage should be able to wear masks for extended period of time. And we have seen this, even with some population folks.
Dr. Chai, I'm sorry, I don't know if everybody else was able. There's a little bit of feedback on your loop, but maybe if you could work on that really quickly, and then we could come back to you for a follow-up on these next questions, because they still are within the realm of pediatrics. And I just want to make it clear again, because we are talking about this thing, and we know in the media and on social media, there's a lot of different conversations about young people. And as we focus on education, obviously young people are involved. So there's a series of questions from the professionals. We want to hear, can young people get this virus? Can they transmit it to either young people or to adults, right? And are they impacted? Like, is there like their symptoms? Will this affect their bodies? So again, I want to hear that. And I know it might sound silly for attendees, but because we're hearing a lot of that in the public, I just want to make sure that we hear from the professionals about this.
Children absolutely can be infected. We've seen children quite young in their first month of life and beyond. We now have documented cases. So we see children of all ages being infected and affected, having clinical symptoms. And there was some good evidence from a camp in Georgia, which only had young attendees. So I don't think there was anybody over 21 there, and there was transmission at that camp. We don't have excellent data yet to show us about ongoing transmission of younger children. I suspect we'll see more of that as schools reopen. We'll get some more data on that.
Dr. Chai, any additional comments on that?
I also want to add that, you know, besides young children, young adults and teenagers also susceptible to this infection and easily transmit this virus to others.
And I think I heard there that in regards to being easily transmitted, and in regards to, and we'll, as we transition from the community aspect to the school aspect, can anybody comment on what a realistic ballpark timeline in regards to a vaccine is? I'll just kind of leave it open to the group. And I'm sure that's like $1 million question, right? Do we have a ballpark idea? Is there, or is that just something that's not able to be answered at this point?
Well, I'll take a crack at it. Hi, it's John Zweifler, and so we're hearing reports. There's at least a dozen firms that are working on vaccines, and some of them are in the final stages of testing and some human testing. There was a incident where one of the vaccines ran into an issue with a human participant becoming ill and had to temporarily stop their testing. So I think it's reasonable to expect that there will be a vaccine in the next 3 to 6 months. Perhaps it would be sooner, perhaps it would be later, and Russia claims it already has a vaccine. But once there is a vaccine, there's going to be a lot of questions that need to be answered even after that, such as how long will the immunity persist? How quickly are we able to scale up production of the vaccine? How many people are going to be willing to accept the vaccine? Is it something that's going to have to be given every year? So there's a lot of issues that are going to be out there. So vaccine certainly would be an incredibly positive development, and I think we could anticipate, at least we would hope that it would first be provided to those who are in highest risk categories. And so you think about your folks in the hospitals and skilled nursing facilities with high-risk medical conditions. But then you also think about congregate type settings, which would include colleges, but also schools. So how that all unfolds, we'll have to see, but it's not going to be an overnight instant panacea. But I'm certainly hopeful that in the next 3 to 6 months, we'll have a vaccine available.
Thank you for that. Okay, so we're going to go ahead and transition into, now that we have some of the community things, we're going to transition and focus for the rest of this time, our 45 minutes that we have remaining, on schools. And but before we do that, we do have a new panelist, and with that, I'm going to have David Lucchini go ahead and introduce our newest panelist.
Let me introduce Melanie Ruvalcaba. She's one of our critical managers here at the Public Health Department. She oversees our Office of Health Policy and Wellness. And she's been a great help in all of our COVID responses, and she's been very helpful in working with us as we work with the schools on this next phase. So thanks, Melanie, for joining us.
Thank you. On behalf of everybody here and educators and our community, again, thank you. And I guess I'll pause there because I forgot to do that at the beginning. I understand that this is probably a thankless job for many of you. The amount of time, the burden and of having to process all this information. So for my own little part, I just want to say thank you on behalf of everybody in the community, because I understand that you're definitely doing a lot of work on behalf of our community. So thank you for that. Let's go ahead and transition into education, and specifically the small cohort. So on August 25th, the California Department of Public Health released a memo, and it outlined some guidance on small cohorts returning to school sites, and not just school sites, but they also outlined other areas as well, whether that be nonprofit type of situations as well. Now, locally, we've seen a few stories insinuate that schools or some school districts are having students come back for instruction. However, that's not necessarily what the guidance is saying. At least from my understanding, I want to make sure that people hear from the health professionals' understanding. So I guess my first question, and we'll go to David first, and then we'll kind of make a round robin here, is regarding the small cohort guidance, is that meant to supersede the governor's July 17th ban on in-school instruction? Where are we at with that?
So this cohort, and even Dr. Zweifler and probably Melanie say it better than I do in explaining this thing.
For sure.
Cohort, but as everything gets created by the state, there's a lot of pushback. So the state's trying to figure out an in-between way. As if students are struggling, how can there be a way that we can help some of those students that are struggling with distance learning and have other needs, that we could at least bring in a small cohort of students with a 1 or 2 adults. Now, they did send that on August 25th, but they did do a revised version on September 4th that kind of changes the numbers. If you think of the August 25th, it was 14 students with 1 or 2 adults. Now it's a total of 16. So technically you can do 15 students with 1 adult. The biggest thing is you can't have an adult supervising oversee different cohorts. That's a big thing that people need to realize. You really have to stay with that same group. Dr. Zweifler, Melanie, you guys add to that one?
Well, yeah, David, you did a good job, and it was designed to address the special needs children that needed some type of education and required services. So individuals with disabilities, folks on IEP programs, English learners. So it was designed to address those specific populations that required services. And we had been, as a public health department, we've been working with the schools on those populations even before this guidance. And so it was good to have something that was very much in line with what we were trying to do anyway, to be able to facilitate in-person education in those special circumstances where it couldn't be accomplished online. And just as in the beginning, we were talking about what do we need to do to stay safe with those cohorts, that all those same expectations remain. So you need to be able to socially distance. You need to have individuals with masks. So the same kind of expectations for the cohorts as we've talked about in terms of trying to prevent the spread of transmission in our community more broadly.
And I just pulled up there, Dr. Zia, and hopefully you could see this in regards to the physical distancing. To give some context to this for our attendees, this is also a frequently asked questions guideline that was attached to the memo. And so yes, I know the state Department of Public Health did issue some pretty strict guidelines in regards to what needs to take place if small cohorts did come back to the school site or any site. Is that correct?
Yes, and to me, that's a really critical element. As we look kind of at the bigger picture, we'll talk about school reopening issues. We want to make sure that we can do it safely. So our best chance to do it safely is to implement all of those the protocols that we know are most effective in preventing transmission. So maintaining social distancing, 6 feet or more between desks, making sure that all the kids are wearing masks, and keeping kids in the cohort so they're not mixing with other groups are all kind of the bedrock elements that we'd like to see, so that we can so that when we do reopen schools, we can do it as safely as possible.
And thank you for that. I'm going to go ahead and just share this and just so I make sure that I do my due diligence in communicating this to our educators as well, because this is also part of this, and feel free to whomever to jump in. But one of the questions in the frequently asked document is this, the intent to allow for in-person instruction for all students. And I just want to make sure that the educators on the line hear that that is not the intent of this document. And again, I'll have the health professionals join in, and please correct me if I'm wrong in this interpretation, but the interpretation is not about having students come back for in-person instruction, however, to provide special services, nor is this a mandate by the state, but some guidance by the state as to, if it happens, how this is going to take place in a safe environment. And so, David, it seems like you had some maybe a comment on that, so I'll just go ahead and have you take the floor with that.
No, it's right. It's not a mandate. It is guidance. It's trying to work and trying to find that right balance where we're trying to meet the needs of parents and the students, but do it in a safe manner. And that's what this is trying to do. So it's really working together, and that's why it's critical for us to all try to be as much on the same page as possible and make sure we're giving good guidance and being consistent.
Yes, thank you for that. And then in our last one of our conversations about this, there was a recommended screening, or at least locally, a screening process if we were to go back for some small cohorts. Is there any suggestion, again, and I'll kind of leave this open to the floor here, as to what a screening process should look like as when people are coming onto a campus? And right now, I'm just taking it in the context of a small cohort. We're definitely going to talk about reopening of schools in just a minute, but in the context of small cohort, is there a screening process that you would recommend? Currently, the model is just a self-screening. Is that sufficient, or should there be something more than that?
Well, I'll take a crack at that. So this is a real very controversial area, and so I think all the listeners should understand that you will get different opinions on this one. The CDC has a list, a fairly extensive list of symptoms that are associated with COVID. So the most common ones are fever, cough, shortness of breath, but you can have headaches, sore throat, nausea, vomiting, muscle aches. So a lot of things that a lot of us experience at various times. So there's a real potential that as you ask all those questions that you're going to get a lot of yes answers. But having said that, there is this list of around 10 or so symptoms that the CDC has identified, and the approach that Fresno County Department of Public Health has taken, at least initially, is to say we want to be as careful and as cautious as possible. So if you have any of those symptoms, then that needs to be evaluated and checked out. The other aspect to screening that's very controversial as well. Do you check a temperature or not? And the CDC has come out and said that although fever is the most common symptom, that it can miss people who are sick, who are infected but are asymptomatic, and it also may identify individuals who have a fever but for another reason, and so they do not recommend it routinely to screen for temperatures. When Fresno County Department of Public Health developed our scenarios for school reopening, we developed our best practices. We included temperature screening as part of that, and the reason we did that is because, first of all, fever is the most common symptom that's associated with COVID, and 70 to 80% of individuals who are symptomatic will have a fever. It's also the only objective finding that we have. So the others are symptoms that are reported to you, but fever is something that we can measure directly. And also because it sends a very clear message to both the students as well as to the teachers and parents and our communities that we are taking this very seriously, and we're doing everything we can to identify individuals who may potentially have COVID. So certainly speaking for myself, I believe that as an initial step in terms of having students on campus, that including screening for symptoms as well as screening for temperature is important, both to identify cases, but also to send a clear message about that we want to keep our campuses as safe as possible.
Yeah, thank you for providing that context for sure. All right, let's go ahead and transition to reopening of schools, everybody's favorite subject for sure. I'm sure that you know have been or have spent a lot of time talking about this. We're going to try to get through as much as possible with our questions in the next half hour or so. But before we do that, I'm hoping that somebody could give a concise explanation of this information. So I'm going to go ahead and put something on your screen so everybody could see. And I assume that you see this. This is the 4-tier system that the state just recently released. And I'll go ahead and pivot back to David in regards to this very quickly. Can you explain this system to the folks that are watching tonight? And when is it that we can, where are we and when can we get a possibility of reopening our schools?
Oh, you're going to make me predict a game. Well, let's go quick.
Well, not necessarily when, but what are the metrics, I guess, involved in this system?
As you know, every time the state changes, I have to memorize something new. So,
right.
So currently we're in the purple. That's the highest, the worst, whatever you want to call it, level, because our average cases per day per 100,000 population over a 7-day period is higher than 7. Like I said, for the week ending August 29th, it was around 12.6. So we stay in the purple. Even if you have to be below the numbers that you show on the screen in both areas for 2 weeks before you even consider to go to the next lower area. So for positivity rate, for the week ending August 29th, we were around 9.8, which is actually great news because we haven't been single digits for a long time. So that's good that we're once again on the right path. So, but we've got to be under the 7 number there. So if you look at our population's a little over a million, we're looking at we've got to be a little lower than 70 cases a day over this last 7 days, and we got to get under that 8%, and we got to do it over a 2-week period. Then we can go to red. Then when you go to the next color down, you have to stay in that color. You could have no more cases. You still stay in the red for 3 weeks minimum. Okay.
And then just out of curiosity on that one, what happens if and during that week, you're going through that first week, that second week, numbers shoot back up? Does that automatically shoot the county back up into that next range? Or
so if in the next 2 weeks, and this I'm trying to read back, but if in the next 2 weeks your numbers go back up, and it only has to be in one of the two,
right,
you can be put back into the purple. Now, schools open, how I understand it, if you get to red and the school's open, you go back to purple. That doesn't really mean automatic the school's closed again. They'll actually push just more restrictions, and I think they'll push more surveillance testing if you go back to purple.
Okay.
Dr. Z, Melanie, am I in the right area? I know these are always changing at the state, but how I read it today, that's how I read it.
Let me ask this question though, because I think that this one that and Melanie or Dr. Dahl or anybody else would maybe want to answer. Just because we go into that substantial, does that mean doors open, everybody, let's get back to school as normal? Or
question.
what do we do then? So Melanie or Dr. Dahl, go ahead and jump in.
Kenny just wants someone else to say it. He doesn't want to be the one to say it. I've been on a couple of calls, and to be quite frank, I think everyone's still trying to figure out exactly what this is going to look like. It's my understanding that, sure, schools could just, open back up, but I don't think any school district would ever do that without consulting with their local health department. We've been working closely with Fresno Unified and all of the Fresno County school districts to make sure that we're doing everything safely and, with science to back it up. So as Lakini said, the schools can reopen, but we've already provided guidance, and I think we'll continue to provide guidance and hope that we just do it in the safest way possible for the students, the family, and all the staff on campus as well.
So I guess I want to be clear on that in regards to my role as a moderator. So although they can, as health professionals, that is not advisable. Am I hearing that correctly?
That is correct. We would not advise schools to just open up haphazardly without consulting us and at least having some, guidance in place. I think any school that opens would want to protect their students and their staff. So they would, hopefully, ideally, consult with us and at least have some guidance in place and protocols in place.
Now, I'm going to go ahead and put something on the screen here right now. From my understanding is that even when they do open and we are able to open, and that this document provides some guidance. At least this is what I found according to the website, the same website with the tier system. Is that correct, or is that something that you have seen in regards to this?
We've
Yes.
certainly seen that document. Yeah, absolutely. And we use that document to when we put our own guidance together. So if anything, we might have done something a little more stricter than what the state advised, but we certainly are familiar with that document. Now, things do change very fast and very quickly, so we'll keep an eye on it to make sure if it's updated that we are updating our guidance in accordance with the state.
And that actually really transitions nicely into the next question in regards to and I just want to be clear, and I'll make it clear, definitely with the panelists, I think that they've gotten pretty good at saying the same thing. We're here today on September 10th, right? And we understand that there might be some changing guidelines, but as of today, what does the Fresno County Health Department utilize as some of their guiding documents? I saw, the one that I just put up there. I assume, and please correct me if I'm wrong, I assume you use some guidance from the CDC and California Health Department or Public Health. Is that correct?
We tend to follow the State Department of Public Health, usually the closest, and then some stuff from the CDC if the State Department of Public Health doesn't cover it. Once again, we cannot be less restrictive than what the state sends.
Gotcha.
We can be more restrictive. So as Melanie was saying, if we decide in the red that as schools open that we want to have some more strict guidelines, that is the prerogative. There's a different word. Someone help me in school.
That's good.
Thank you. That the health officer can
Discretion.
Thank you. That the health officer can provide more restrictive guidelines if they want to, if they feel based on the conditions in the community that we need to be more strict. So that is an option for the health officer. But once again, we want to work really closely with all the school districts to make sure we do it right.
For sure. And let's go ahead and get to some of the specifics, I guess, in regards to the reopening of schools, and then we'll get into some of the member questions as well. Just as a specific, I'd like to hear from any of the doctors on the line. Like one of the conversations we have in regards to, we know on social media, we have many comments about, well, why can't we just open up our school? Why can't we do this? But from my understanding, is it true that just by the very nature, indoor congregate settings are inherently a high risk area or space in order to spread this virus, or I guess any virus, but Dr. Dahl, I see you nodding your head. Maybe you could speak to that.
So absolutely, indoor environments are more at risk. Air handling is important, and most of our buildings, schools and otherwise, were not built with that in mind. And I think opening schools up as everybody's desire and doing it safely is really important, but we have to be realistic and realize even with the safest way to open schools during a pandemic, there are going to be cases, and to be prepared and have a plan for how you manage those cases is really important. And I think one of my concerns at this time of year is we just had a Labor Day holiday, and so we're all looking closely at those numbers. I don't know how fast the county numbers come in. We have a testing site at the hospital, and I know I've already seen a little bit of a jump in my numbers, and we're at the 4 to 5 day mark for when we might see symptomatic people. And I think we, as a society, have to learn the lesson about holidays and gatherings. And Labor Day is not our last one. We're going to have Halloween might be a gathering for some people, and Thanksgiving, and then Christmas. And I think that could really impact the situation in the schools if we're not careful around those holidays. And again, those are going to be indoor gatherings for families with the weather changing.
Yeah, and possibly depending on those numbers, also that obviously the setting of the school site plus the additional events that you talked about. I had this question for a little bit later, but I'm going to go ahead and bring it up right now because we are on the topic of this indoor space. I've read a couple of recommendations from the CDC, and so I just want to throw it out there in regards to air filtration. You talked about our buildings not necessarily being built for this, sort of thing. Does the county at the local level have any type of recommendation in regards to air filtration? I've read numerous times of this MERV 13 number coming up, and I don't claim to be an expert in that in any way, but I was wondering if the county could give any guidance in regards to air filtration and how that might take place. I'll just kind of leave it open to the board or the panel here.
I'll let Dr. Z might be the best on this.
Well, a few things. First of all, it's a very technical area. I'm a physician and not a HVAC engineer. Fortunately, the Fresno County does have a HVAC engineer that we've worked with in the past, and so we've been talking about how can we get them involved to maybe provide some guidance in this area. But some really basic things, first of all, whatever you can do outside as opposed to inside. And the other is keep your windows open if you can to improve air circulation. But you're at the schools, they should certainly be looking at it. There is guidance that CDC has provided about air filtration and the amount of times that the air turns over in the room per hour, and some really technical things that I'm not really an expert in. But it's absolutely something that needs to be considered, and it's why we've really pushed to do as much outdoors as you can, and to keep the windows open, particularly on for example, when in transportation on buses.
Yeah, and I appreciate that, and I don't want to put anybody to speak to an area maybe that's not their expertise, but I guess the bigger picture that I'm taking away is that it's definitely something as a health professional that you're stating that should be a consideration, and that the school district should take a look at in regards to their planning for a return to school. Am I hearing that correctly?
Absolutely. Okay. And as has been mentioned, the more people you have in a small space, the more concerning it is. And you touched on the different guidance from the state and the cohorts and the industrial guidance for schools. And one of the biggest differences between the cohorts and the return to school document is the restrictions on the numbers and on the cohort. So starting with smaller groups where you can socially distance is going to reduce the burden in your enclosed spaces.
Okay, we have a couple more moderated questions, and then we'll jump over with our 20 minutes remaining to some member questions that we had. But really quickly, is there, when we do return to school, Dr. Chai, Dr. Dahl, or Dr. Z, if you want to chime in regards to this, is there anybody that shouldn't be coming back? Like recommendations in regards to health conditions that say don't come back to school? Or any guidance that we could look to in regards to that particular topic?
I can take on this one. Can you guys hear me?
Yeah, I think we could hear you a little bit more now. Why don't you go ahead and go for it? We'll correct if we need to.
All right. The group that I worry about mostly is those who have some immune defect, or kids who have underlying medical problems, chronic medical problems. Those are the ones that obviously most helpful in terms of coming back to school in person. I think this has to be done on a case by case, with the consultation to that case primary physician or family physicians.
Thank you, Dr. Chai. It sounded like you were saying anybody that with any type of medical conditions that would, necessitate that they stay home would be the ones that wouldn't be able to come back to school during this time whenever we were allowed to come back. All right, and so now when we talk about schools, Melanie, this question, I'm going to start with you, and I'm going to have others kind of chime in as well. because it was interesting to hear your perspective on this in the previous meeting. And so when we talk about preventative measures, we know that a bedrock, as Dr. Z had previously mentioned, of this was not only the mask, but the physical distancing of 6 feet. And so as a health professional, as a mother, do you think that in returning to schools that's something that should be standard as a preventative measure?
Absolutely, yes. And again, and I mentioned last meeting, I am a mother of a 6th grade Fresno Unified student, and so I make my opinion pretty well known around the office. So I wouldn't want anything less than that to happen for my daughter to go to school. And again, to protect the health of the students and the teachers and the staff. And I know there's, lots of parents that sometimes like to be on campus, so we'll have to really watch that. Do you need to be on campus? And if you're feeling any kind of symptoms, you need to be on campus. And you need to continue to wear your mask. You need to continue to wash your hands frequently or sanitize your hands frequently, and where possible, have that social distance. When we're doing our contact tracing and our medical investigations, and we ask a confirmed positive patient about their contacts, if they were close to somebody, but they had their mask on, they're not considered a close contact anymore. So that really slows down the spread. And if we keep those cohorts small, we'll reduce that spread. So absolutely, we need all of these safety precautions in place until we can have a viable vaccine. And again, that's me speaking as a health professional and as a parent.
I appreciate that. Any more insight, Dr. Dahl? I mean, obviously this is your work day in and day out. Is that something that you would agree to in regards to the preventative measures once we do reopen?
Absolutely, and I think it just emphasizes the point. That's how we do contact tracing. How far apart were you, and were you wearing a mask or not? And that's been really successful across the world in helping us track this disease. And so it's not incidental contact that we worry about so much, but close contact and not wearing a mask. And that's really been the mainstay of our practices at Valley Children's at the hospital, to keep our employees safe and our patients safe. Even when we're not around patients, our employees all have to maintain social distancing, and we are all wearing a mask and eye protection, which is a little bit different level of protection because we are a hospital, but we're all wearing that all day long unless you're in a private office. And I think that's been very successful. So we practice that, and it does make your setup a little bit different, and you have to make some accommodations for it. It's not easy. It takes some getting adjusted to, but like symptom screening and temperature taking, maybe you'll have a little bit of a rocky start. It's good to start with a small group, but it's been really helpful in keeping our staff safe, as well as the children at the hospital. So I completely think you have to have both the mask and the social distancing.
And I just rounded up with Dr. Z. Anything to add really quickly? We have about 17 minutes until we end our conversation. Anything to add to that? I would imagine that you're in agreement with that, but I'll let you speak quickly on that.
Well, one of the corollaries of social distancing is smaller cohorts. And when we've originally worked on this with the Fresno County Department of Public Health, we talked about limiting class sizes to 10. The state came out with cohorts of up to 14, but both those numbers are considerably less than a normal class size. And so I think that's one of the real issues for as we think about the reopening process. And it's why we here in Fresno County, we're actually in an interesting position. We're in the purple. So what that means is, as we come down, that if you want to reopen, it has to go through a waiver process. And if we go through the waiver process, we can actually include various conditions, such as the smaller class sizes of 14 or less. And so I'm glad we're in that position to say, hey, to begin with, let's start with these smaller class sizes. Let's make sure we can do it right before we, rather than finding ourselves in the red or yellow zones and schools being able to open without any type of restrictions. So I really would like us to open with the smaller class sizes so that you can maintain that social distancing.
Gotcha. PPE has been a huge thing as well. I mean, it's kind of entered our social consciousnus, our lexicon, in regards to that. Like we have a lot of different educators throughout our campuses, and it was a fascinating conversation when we talked about PPE last time. And so right now, everybody's really using those cloth masks. And I would imagine that those are good for certain settings. Do you recommend anything above and beyond that for any particular groups? And I'll just give some context to that. We represent nurses, who obviously school nurses, certificated school nurses on the site. But then we also have a number of not only nurses, but special education educators that are working with students that have medical needs, whether that be feeding tubes or other items, right? So knowing some of that context, is there any recommendation about PPE usage? And I'll just kind of leave that open to the panel.
Well, I can start. So one of the premises is that we're doing screening. We're making sure that only low-risk individuals are coming to school. So is there a chance that an asymptomatic individual will end up in the classroom? Yes, that is a possibility. And are they likely to then transmit it? Well, it's possible, but if they're wearing a face mask, that's even more unlikely. So by putting in these basic kind of safety measures, the likelihood that there's going to be a serious transmission in the classroom is greatly reduced. And then if you maintain your social distancing, that's an added level of protection. In terms of, what can we do to reduce the risk further? There are other more effective forms of PPE, in particular the N95 mask, as it comes to mind. Those are reserved for use in hospital settings or with healthcare professionals when you're dealing with individuals who are known to be COVID positive, or that you suspect that they're COVID positive, or if you're in a situation where you're taking care of a patient and they have to get a nebulizer treatment, and where they're at greater risk for spewing what we call aerosols. And so it's really very specialized circumstances where more extensive PPE is required. And so I think the way to think about it and to approach it is, we need to do, we're putting these steps, preventive measures into place so that we significantly reduce the risk of transmission. We're dealing with a low risk population because they're screened. We're dealing with asymptomatic individuals who are less likely to be coughing and to spread the virus. And so for the vast majority of situations, wearing a cloth mask for both your students and for your teachers is going to be adequate protection. If you're in a high-risk situation, you need to have access to PPE. And so if you do have someone who's symptomatic, there should be availability of PPE. And when we talk about that PPE, that includes not only a face mask, but it also means wearing goggles and wearing a gown and gloves. So if you have a child who's symptomatic, there needs to be someone who has that full PPE who can transfer that child to a quarantine area and can monitor that child. So that it's important for each school to have thought through that process. But for your frontline teachers, where you're doing your screening, your students are wearing masks, you're maintaining social distancing. It's not you don't need to have the full PPE in the course of the normal in the course of your normal activities.
Appreciate that. Thank you for that information. We have only one more moderator question, about 10 more minutes, and I hope that I could convince you and twist some arms to stay for about 5 more minutes after that. And I understand that it's late in the evening already. But it was an interesting thing, and I'm wondering if one person could maybe just quickly explain it as concise as possible. But this difference between isolation versus quarantine. I found this very fascinating, but I also thought that it was important as we talk about what that might mean for our students and what that might mean for our staff members, any employee throughout the district. And so I don't know who wants to try to tackle that in a very concise manner, but if there is somebody that might be able to do that quickly, so that way we could get to our member questions.
Melanie, have you done that spiel, team?
Yeah, I think so. Let me start because I think I talk faster than anyone else. And then if someone wants to add in, they can. So when we talk about isolation, it's only for COVID positive patients that are confirmed positive. And so if you are confirmed positive, you should be told to isolate. And we ask you to isolate as much as possible from your entire household. If you can be in a separate room and use a separate bathroom, that's great. If you can't, we have protocols in place to help you slow the spread or reduce contact with other household members. But we ask you to self-isolate for a minimum of 10 days and 24 hours fever-free. So that is from the date that you started having symptoms, or if you had no symptoms, it's from the date that you took your COVID test. So again, isolation is only for COVID positive patients. Now, when we say quarantine, it's usually someone that you've been a COVID positive patient has been in contact with, a close contact. That's what we call a close contact. So this could be a household member, it could be a coworker, but if you've been in close contact with someone that is a known COVID positive patient, then we ask that person to quarantine for 14 days. And if any time during that 14 days they start to develop symptoms, we will assume that they're positive, but they can most certainly go get tested. And I know it seems a little bit backwards. Why would a positive case have less days than a quarantine case? But that's because the virus can incubate for up to 14 days. So if you've been in close contact with someone, we want you to stay away from anyone for at least 14 days so you don't unknowingly spread it to somebody else. So that's kind of it in a nutshell. Anyone else can add to that, or if there's questions, I'm happy to try and answer them.
I'll just leave it to was that a good explanation? I think that it sounded, yeah, okay. I thank you for that. It did pass the test in regards to that. Again, I appreciate all your guys' time. With about 8 minutes, and I'll twist some arms to hopefully get a little bit more out of you. We're going to go to some of the questions from our members. Now, these questions is for our panel, so you know. We asked people just to submit some questions, and we chose the ones that we thought were most relevant to the conversation, obviously with education as the context. So one of our members asked, like, when we do return to in-person instruction, how can we best protect our family from getting sick, like taking something home? And again, I'll just kind of leave it open to the panel and concise responses that we can get through as many of these as possible.
Let's have one of the physicians do that one.
For sure.
This is Karen. We've had that question obviously come up a lot with our healthcare workers, and there is no hard and fast guideline, but you find your risk acceptance level in between. So a number of our staff, when they come home, they stop in the garage and they change out of those clothes and they put on new clothes and they wash those clothes. And that is before they go in the house. So they leave their clothes in the garage, get new ones, and come in. And some of them go directly and shower. Again, that's not a hard and fast recommendation. I go to the hospital every day, and unfortunately for my husband, I don't follow that, but he's been well, we've been well. And there isn't a lot of transmission data that fabric is a good carrier for the virus, and that contact with someone onto fabric and then someone else touching that fabric. We haven't seen really that. That's not part of our contact tracing, but I do think it gives some people some ease of mind. And I would never recommend against it for people who are concerned about it. So that's one way people feel like they're taking a step to make their family safer, and it certainly doesn't increase anybody's risk.
Thank you for that. In fact, that's a good segue to the next question, particularly in an education context. We have obviously educators that are taking home, whether it be binders or notebooks or things that they need to grade for students, those types of things. So, and obviously being in the classroom as well. So the question from the member was, how long does the virus live on physical surfaces, right? I mean, there's obviously a concern if students are turning in notebooks and then I'm taking that home, and so how valid of a concern, and how can we try to mitigate some of that?
Let me try this one. So the virus, this COVID virus, can live on the surface for several hours, sometimes up to a day. Depends on a variety of things, temperature, humidity, sunlight. So there's no clear magic number for that. So I think anyway that the teachers take home and try to clean it as much as they can.
So thank you, Dr. Chai. It sounded like you said that the virus could live for a few hours to up to a day on physical surfaces. So if there is a concern, to make sure to clean or wipe down that before taking it home, which again, I promise, I wish I was this well or good of a producer. I'm not, but it segues perfectly into my next question.
Oh, can I add to that?
Yeah,
I'm
go
sorry.
for it. Go for it.
Oh, so I think in general, we do have concern about surfaces, and we clean surfaces in the hospital, obviously.
Right.
But in the rest of the world, it's not the hospital setting. It's a little bit hard to wipe down every surface that you come in contact with. And that's true when you're going to grocery stores or other things. Hand washing is the really important thing. So although you cannot sterilize every surface, when you're done grading that notebook and those notebooks, you should be washing your hands. And that is a really effective way to reduce transmission if there is any viable virus on the notebook or other material.
Yeah, no, I definitely appreciate that. Still, a great segue in regards to effective ways of cleaning surfaces. This virus has allowed for many different narratives to come out on social media. And so we're just wondering, what is the most effective way of cleaning surfaces, whether that be surfaces or tables at school, and do these like UV lights work, or what's all that like? So is there any medical advice in regards to how to clean surfaces, or what's the best way of doing that? Or is it simply just the tried and true soap and water?
A lot of the common household products, there's EPA, if you go on the CDC website, there's a lot of EPA approved products that are great to use and work very well. As for the UV lighting, I've heard different things. So the physicians may have more on the UV lighting research.
There's different types of UV lighting, and certainly some, there are different wavelengths of UV lighting. So some have been seen to be effective for killing coronavirus, but again, I'm not an engineer. We happily have those people at the hospital who can help us with that. And the only caution I would say about the disinfectants, I like that CDC link to the EPA. There's at least 5 pages of effective disinfectants. But what I think people don't always pay attention to, and what may help you make a choice among those hundreds of choices, is the contact time. So the contact time is how much that cleaning agent needs to be in contact with the surface before the virus is no longer viable. It's a minimum of 30 seconds, but some of them are a maximum of 10 minutes. So just wiping something down quickly is not going to be effective. And that's just something we've had to deal with in the hospital setting for years and years. So we're sort of attuned to that. But if I were going to pick a disinfectant, I would look at the contact time of those on that list.
Thank you. Yeah, valuable information on that.
When you say the contact time, that's on the labels and all that? Or you have to?
It's, well, on the hospital approved one, it's on the bottle. On the EPA site, it's right there. It tells you what the brand name is, and then the far right-hand column tells you the contact time. So you can at least look there if you're looking for your favorite brand and see what it is.
I have to check consumer reports for my favorite brand. I'll see.
We got one last question or two in before we end tonight, and we have some educators that take care of some of our neediest students, right? Those that either need feeding tubes, like I mentioned prior, or other medical services, changing those type of aspects. So a couple of questions related to that. Are there any PPE requirements or recommendations, I should say, for those educators that are in spaces where maybe their students are just not able to have a mask on because of those medical concerns that they have? Yeah, and I'll start there, and I'll have a follow-up question to that. So, any recommendations for that?
Well, those are higher risk situations where the student can't wear a mask, and they could be even higher if they have things like a tracheostomy tube, or if there's a greater risk for secretions. And so in those situations, more protection may be needed. The National Association for School Nurses has done a nice job of sorting out these issues, and Manuel would be happy to forward you that information. But they, similar to our discussion before about PPE, in most situations a mask is adequate. Unless the patient is a known COVID positive patient, we don't recommend that full PPE. If they're not able to, and when I say full PPE, what we're really talking about, do they need an N95, the most protective type of face mask? And Dr. Dahl, Dr. Chai might chime in. In hospital settings where you're dealing with known COVID positive patients, it's a different story. But in our ambulatory settings where you're dealing with individuals who are asymptomatic and have we don't suspect COVID, you're dealing with a lower risk situation. We don't recommend the N95s, but a mask and/or gloves and gown or goggles might be indicated. But there's some discretion. Usually in these situations, you have nurses who are pretty familiar with the patients. And so they understand the patients and they can balance the kind of providing the needed services to the patient with ensuring that everyone is safe. So those are very specialized situations. I also think these are the kind of situations where individuals like Dr. Dahl and Dr. Chai get involved to say, hey, these are my patients. They have very complex medical conditions. This is how we would recommend that they be cared for. So I wouldn't hesitate getting the patients with these very specialized medical needs, having their physician involved to provide some guidance and feedback on what type of protective care might be indicated.
For sure. Thank you. We have now approached the end of our time, and again, want to be respectful of everybody's time involved, because I know that you guys are working very long hours. And so just a quick recap for those that have joined us or may have joined us late, right, is this idea that we are, at least it sounds like we're trending in the right direction. We need to continue to do that by doing these, as the health professionals mentioned, the bedrock preventative measures for community transmission, and that is the physical distancing, wearing a mask. So please make sure that you're doing that in all those spaces, and don't go to not outdoor events, but group events in any way, to make sure that as a community we're doing our part. In regards to the small cohort, not a mandate, but guidance on how to do that, with some pretty strict rules, with hoping that we are able to help facilitate instruction, but not actually provide in-person instruction at the school site. And then the reopening, obviously, we had a pretty long conversation about what that means and some of the bedrock items there as well, in regards to physical distancing, wearing a mask even when we do come to reopening our schools. So with that, I just want to say thank you again on behalf of all the educators in the Valley, in our community. Thank you for doing the work that you're doing. Please stay strong in all of this, and I'll just kind of leave it open for any closing remarks that you may have before we end tonight.
I'm going to say thank you for the time, and thank you everybody on the panel for joining us. But I have homework for Mr. Bonilla.
Okay, homework.
He's going to tell us which population would have struggled with COVID-19 that's in the Lord of the Rings. I'm trying to figure out.
Yeah, it's definitely the orcs. The orcs would definitely not want to wear masks for sure. The hobbits would be great. Wizards they're actually immune. They're the ones that are going to find the vaccine. So,
you were ready for that.
I was ready for it, man. Lord of the Rings is, hey, it's awesome. So So anyway, all right. Well, hey, thank you guys again for all the work that you're doing. Thank you for everybody that joined us here tonight. I hope that you guys have a great rest of the night, and we'll see you later. If you know somebody that missed tonight, we are going to post this later on tomorrow. So thank you again.
Thanks everyone for their hard work too.
Thank you.
Take care.
Thank you.